Difference between transient tic disorder and chronic motor disorder. Look at this picture shows that transient tic disorder and chronic motor disorder. A detail going on. Transient tic disorder. It is characterized by the presence of motor or vocal tic that last for at least 4 weeks but less than 12 months. Chronic motor disorder is characterized by the presence of motor tics that persist for more than 1 year. Difference between one duration transient tic disorder tics last for at least 4 weeks but less than 12 months. Chronic motor disorder tics persist for more than 1 year. Two types of tics. Transient tic disorder can involve both motor and vocal tics but not simultaneously. Chronic motor disorder involves either motor or vocal tics but not both. 3. Prevalence. Transient tic disorder more common in children, often resolve on its own. Chronic motor disorder less common and tend to persist longer, sometimes into adulthood. For severity, transient tic disorder typically mild and self-limiting. Chronic motor disorder can vary in severity and may require management strategies. 5. Age of onset. Transient tic disorder usually begins between age 4 to 6. Chronic motor disorder typically starts between age 5 to 8. 6. Prognosis. Transient tic disorder often resolve completely within a year, but chronic motor disorder may persist for many years, even be lifelong. 7. Diagnosis criteria. Transient tic disorder diagnosis required tics to be present for less than 12 months. Chronic motor disorder diagnosis requires tics to be persist for more than 12 months. 8. Impact on daily life. Transient tic disorder usually has minimal impact on daily activities. Chronic motor disorder can significantly impact daily functioning and quality of life. 9. Comorbidity with other disorders. Transient tic disorder less likely to be associated with other psychiatric disorders. Chronic motor disorder more commonly associated with ADHD, OCD, and other neurodevelopmental disorders. 10. Respond to stress. Transient tic disorder ties may increase with stress but are generally less severe. Chronic motor disorder tics can be more pronounced with stress and anxiety. 11. Genetic factors. Transient tic disorder less likely to have strong genetic component, but chronic motor disorder may have a strong genetic link, often running in families. 12. Treatment approaches. Transient tic disorder often managed with resource and behavioral strategies. Chronic motor disorder may require behavioral therapy, medication, or combination of treatments. 13. Vocal tics. Transient tic disorder can include vocal tics, but they are less common. Chronic motor disorder may, by definition, involves motor tics rather than vocal tics. 14. Medical attention. Transient tic disorder often does not require extensive medical intervention, but chronic motor disorder may require ongoing medical and psychological support. 15. Educational impact. Transient tic disorder typically does not interfere significantly education. Chronic motor disorder can interfere with learning and school performance, requiring accommodations. Thank you. Have a nice day.